The CDC is sharing updated guidelines for those who are asymptomatic or have been exposed to COVID-19. The agency also lowering its estimates of how widespread the Omicron variant is spreading in the country. ABC's Inez de la Cutera has more from Washington.
With new COVID-19 cases surging across the nation, the demand for COVID tests is rising. Testing lines from New Jersey to Virginia still wrapping around the block.
Quite a few months ago, we had come for testing, and the line was nowhere near this long.
The CDC now lowering its initial estimates of how many of these new infections are caused by the highly transmissible Omicron variant, down from 73% to 58.6% of all new cases. Omicron still remaining the dominant coronavirus variant in the U.S. This, as health experts report nearly 200,000 more children testing positive last week, marking a 50% surge since the beginning of the month. Pediatric hospital admissions on the rise nationwide, up 80% in the past 4 weeks. New York Governor Kathy Hochul.
Parents, we could avert all this if every child were vaccinated.
And New York City Mayor Bill de Blasio saying he's working to keep schools open.
Right now, we do PCR testing in every school every week. We're going to double the amount of testing we do in schools.
The CDC, meanwhile, updating its guidance for asymptomatic Americans infected with COVID-19, cutting the isolation period in half from 10 to 5 days, followed by strict mask wearing for another 5 days. But the CDC not recommending asymptomatic positive people first test negative before coming out of isolation.
Well, the entire reason why we want people to isolate is because they're contagious and they can spread the virus to other people.
The CDC is now reporting 6 states saw their daily case averages double or triple in the past week. Inez de la Cutera, ABC News, Washington.